take you to Kericho, where the news broke this morning that the suspected case of Ebola had been arrested there, and the woman was put in isolation. And let's listen in.
It is, but as it is right now, we don't think it's Ebola, but we don't want to take chances, and that is why we've taken samples to KEMRI, and we're waiting for the results in the course of the day. Possibly by around 4:30 or 5, we should be having the results back from KEMRI to either confirm or rule out Ebola. As early as 4:30 p.m. today, we will have known, we will have received results from KEMRI to know whether it's Ebola for sure or another disease. But as it is, we have just taken the precautionary measures. We don't want to, because we've been on a high state of alertness, and our surveillance team working with the private picked it, and here we are now, just to make sure that we put everything in place and wait for the results. If it's Ebola, yes, we still have the capacity to handle. We have also been joined by an expert from WHO, Dr. Peter Gidhua, working with our local expertise. He's worked in West Africa, and we are looking at this case together keenly and closely. So the results, we expect them at 4:30 p.m. or 5, thereabout today.
How many are in isolation?
We have the patient herself, plus the husband who has no symptoms, and 2 other people who came into contact with her, because as she traveled from Uganda, she was already feeling ill. So by the time they reached here, I think she just went to a private facility, and that is when the alert was issued out, and we went for the patient. We brought the patient here. We have isolation facilities here, and we've isolated the patient. So they're all there quarantined because of the contact, but they don't exhibit any symptoms at all. It's just the patient who's still unwell. And until we get the results, we can't say it's Ebola or not Ebola.